Hello and welcome to Hip and Knee Club. This is an educational talk to prepare you for your upcoming hip replacement, so you know what to expect from your surgery and also what is expected of you before, during and after your stay. Here is a short video to show you what to expect from a physiotherapy point of view when you come in for your operation. Thanks for listening. Hip anatomy. Here you can see a healthy hip joint. It is a ball and socket joint with a layer of cartilage to protect the bones. The other picture is of an arthritic hip joint. The cartilage has worn away and the bones begin to rub together and also become worn. This causes the pain and the stiffness you are likely experiencing. What is a total hip replacement? The ball and socket joint of the hip is made up of two parts, the acetabulum, which is the socket, and the head of your femur or thigh bone, which forms the ball. The operation involves replacing these parts with prostheses made of metal and plastic. What are the benefits of having a total hip replacement? Your pain will be reduced, your movement will improve, and this will lead to a better ability to do your normal daily tasks and the things that you want to do. What are the risks? As with all surgeries, there are some potential risks involved, and whilst they are rare, we do need to make you aware of them. MRSA. This is a bacteria which normally lives harmlessly on the skin. It only causes problems if it gets deeper into your body. Prior to your surgery, you will have a screening test to see if you carry MRSA on your skin. If you do, don't worry. You will be given a special wash and/or cream to remove it. You will then be able to have your surgery. It would also be helpful to remind any visitors you may have to not sit on your bed or chair and wash their hands thoroughly when they enter and leave the ward. Blood clots. Clotting is a normal healing process, but can cause problems if large clots form and move to other parts of the body where they could potentially have serious consequences. To reduce this risk, we ask you to avoid taking long car journeys for the 4 weeks prior to your surgery, and again for the 3 months after your surgery. Long journeys would be more than an hour. If you need to take a long journey, stop every hour or so and get up and walk around. You will also be given special compression stockings that you will need to wear in hospital and for 6 weeks after your surgery to help with your circulation. You will be prescribed blood thinning medication if you do not already take it. You will take this for 4 weeks after your operation. Infection. This is unlikely, but is always a risk when you have a wound. To decrease the risk, please do not touch your dressings unless advised and keep your wound dry. Make sure you wash your hands before and after touching your leg if required, and make sure others, including healthcare professionals, do the same. If you do get an infection, you'll be given a course of antibiotics to help clear this up. Signs of infection can include a raised temperature, increased redness, oozing, or increased pain in the hip. You should contact your GP as soon as possible if you think you may have an infection once you get home. Joint failure. Sometimes, although rare, the body can reject the metalwork and this can cause further complications. If this happens, the consultant will speak to you on a one-to-one basis about what happens next. The metalwork may need to be removed and put back in again at a later date. This may increase your length of stay. Dislocation. Again, this is unlikely. To perform your hip replacement, the surgeon must cut through muscles and stretch ligaments, which usually keep the hip stable. Doing the exercises shown to you by the therapy team during your stay will help strengthen the muscles around your hip, making dislocation less likely. To reduce the likelihood of dislocation, we also have some precautions you must follow. I will talk about this later. Pre-admission appointment and the day of your surgery. You will be contacted by our pre-admission nurses to determine your fitness for surgery and anaesthetic. You will also be informed of the process for attending for some diagnostic tests. You will also be contacted by someone about what to do and where to go on the day of your surgery. Spinal anaesthetic. Spinal anaesthetic is an injection into the small of your back which numbs the nerves from the waist down. 95% of our joint surgeries are done under spinal anaesthetic. Because it has less side effects, patients are able to eat and drink immediately post-operatively, and hospital stay is often shorter. You may be worried about being awake. Please don't worry about seeing or hearing things during your operation. We use screens to prevent you from seeing anything. You can bring in something to play music to listen to throughout your operation. If you are still worried, you can discuss things with your anaesthetist, who will be able to give you a sedative to make you feel sleepy. General anaesthetic. This is when you are put to sleep. This is the riskiest type of anaesthesia, and many of our patients are unable to have a general anaesthetic. Even our healthiest patients sometimes feel quite rough after a general anaesthetic. After your operation, you will have no feeling in your legs due to the spinal anaesthetic. You might have a drain inserted. When you return from theatre, you will have a wedge-shaped cushion between your legs. You should take regular pain relief, and you will have an X-ray at some point before you are discharged to check everything is okay. Once you are home, you will wear TED stockings or compression stockings for 6 weeks. You will wean off your elbow crutches or sticks before your 6-week checkup with your consultant. You will have your clips or stitches out after 2 weeks via your GP. You will need to book an appointment with your practice nurse for this. You will have a consultant review at 6 weeks. You won't be able to drive for 6 weeks. If you do, your insurance may be void. Once you are at home, it is your responsibility to continue with your exercises and progress walking. Occupational therapy. In our therapy team, we work jointly, so you may see a physiotherapist or an occupational therapist and our assistant staff. We will order any equipment needed to help you observe your precautions. Washing. We do not recommend getting into a bathtub as this may cause you to bend your hip more than 90 degrees and it is a slip hazard. We recommend a strip wash or using a walk-in shower. Dressing. Please ensure that you bring a selection of loose-fitting clothes with you. We will show you how to dress your lower half using small aids, which you will need to purchase. Patients who live alone. Our aim is to keep you as independent as possible. There are only a few things that you can't do after your surgery. These are putting on your own TED stockings, carrying heavy shopping, and doing heavy housework. Consider whether you have family or friends who can help you with this. If not, you can discuss this with us. Things to do now. Infections in your mouth can become an issue if it travels to your new joint. If you think you have any issues with your teeth or gums, please go to your dentist. It would be preferable to have a checkup either way. Similarly, if you're feeling unwell or think you may have an infection elsewhere, contact your GP. Book the removal of your clips with your practice nurse for 2 weeks after your surgery date. If you currently have no rails on your stairs and you are struggling with the stairs, you should think about getting at least one rail fitted, as this will help you after your surgery. You should start to do your routine exercises that will be in your booklets. You should think about bringing a pair of sensible shoes. If you want to wear slippers, we recommend slippers with backs, as these are easier to walk in after your surgery. Key messages. It is important to remember that your recovery will be hard work and you must be prepared to put in a lot of effort for your rehabilitation. You must have your surgery at a time that suits you. Remember, your operation will make you better, not worse. So if you lived independently before your surgery, then you will do so again after your surgery. Contact numbers. The therapy office number is 0121 507 2916. This is just for therapy related questions. For anything else, please call the main hospital on 0121 554 3801 and ask for the person or people you need to talk to.
Morning, Hazel. Morning. We're just going to run through your exercises, okay? So the first one I want you to do is ankle pumps. So with your ankles, I want you to move them all the way up towards you. That's it. And then push them all the way down. That's it. And I want you to go up and down 10 times in a pumping action. Good. And that's going to circulate all the blood around your body, okay? The second exercise we're going to do is for your knees, okay? So you're going to push your knees down straight into the bed, and I want you to contract your thigh muscle, and I want you to hold that for 5 seconds, okay? And relax. Good. And then push down again. Hold for 5 seconds. 2, 3, 4, 5, and relax. Okay. The third exercise we're going to do is bottom clenches. So I want you to squeeze your bottom muscles together, hold it for 5 seconds, and then relax. Okay. So squeeze, 2, 3, 4, 5, and relax. Good. And again, squeeze together, 2, 3, 4, 5, and relax. Okay. So you do each exercise 10 times each every hour. Okay. Okay. So now we're going to practice getting off the bed and then back on again, all right? So I'm just going to measure your bed to see if it's the same height as what yours is at home. Perfect. Okay, so what I want you to do then is I want you to bring your legs round to the edge of the bed. So one at a time, that's it, lovely. Good. Well done. Okay, and now we're going to practice getting back on. So what I want you to do this time is I want you to take your bottom back as far as you can. That's it, try not and twist. That's it, all the way back. That's it, lovely. And then I want you to go towards the head of the bed that way. Okay, and then I want you to step your legs round. Perfect. Back onto the bed. Lovely. Okay, so you're able to get on and off your bed at home. All right, so we're going to come back off now. Okay, and we'll practice some walking. Right, Hazel, so now you've done all your exercises, we're going to do some walking, okay? So to stand up, what I want you to do is pop both your hands on the chair, okay? Slide your bottom forward a little bit, lovely. And then you're going to push up through the chair and then have a stand up for me. Perfect. Hold on to the frame, okay? Now to start walking, what we're going to do is move the frame forward first, then step your operated leg and then your better leg. Good, okay? And continue. Operated leg, non-operated leg. Okay, we'll go that way. Perfect. Okay, Hazel, because you did really well with the frame, we're going to progress you on to the elbow crutches, okay? So if you stand up as you did before, so push up on the chair, that's it, and just hold on to the frame with one hand. Can you just drop one hand down? I'm just going to measure you for the crutches. So just stand up nice and tall for me. That's lovely. If you want to pop one arm through the top, and on the other side, pop one arm through there. Okay. So we're going to use the crutches the same as the frame. So both the crutches go out in front, both together. Then your operated leg, then your good leg. Lovely. And again, crutches, operated leg, good leg. Sit all the way around. And before you sit down, take your arms out the crutches. Okay, if you put them both together in a H shape like this, put one across the top and then reach back for the chair. Lovely. Well done.
Hello Hazel, I'm going to go through your standing exercises with you now. I'm going to demonstrate them to you. I'd like you to do each exercise 10 times every hour and continue to do them when you go home. Okay, so the first exercise, you're going to bring your operated leg up towards you, remembering not to bend more than 90 degrees. So up and down, okay, and you'd repeat this 10 times. The next exercise, you'll bring your operated leg out to the side, squeezing your bottom as you do so, and back in, making sure that you don't lean your body to the side. Again, repeat 10 times. And the last exercise, you're going to bring your operated leg out behind you, squeezing your bottom. Again, making sure you don't cheat by leaning forwards. Repeat 10 times. Do you want to have a go? That's fine. And leg out to the side, squeezing your bottom as you do so, and back in, and again. And leg out behind you, squeezing your bottom and back in. Lovely.
Okay, so if you take this crutch out, and you're going to pop it alongside the other one, that's it, and then you hold on to the rail. You're going to go with your good leg first, that's it, all the way. Yeah, keep going with your good leg. So keep that crutch down, good leg. There you go. And again, good leg.
Do I have to put the crutch on there?
Leave it there, yeah. Good leg again. Lovely. Perfect. Well done. And then coming down. Okay, so you take this crutch out. Hold on to the rail. So crutch comes down first. That's it. Then your bad leg. That's it. Don't forget your arm. Well done. Perfect. Okay.
Thank you.
Okay. Hazel, so you had your surgery 3 months ago now.
Yeah.
So how did you feel prepared for your surgery?
Yes, through the physios and the knee and hip club.
Yeah.
Yeah. Asking questions.
Yeah. And did you feel like there was lots of information?
Yeah.
Yeah. And
Brilliant.
did it cover everything that you needed to know before you came in for your operation?
Yes.
Perfect.
Yes.
Okay. So you had a spinal anaesthetic. How did you find that when you come back to the ward?
Great. Yeah. No
Good.
problem at all.
Good.
No.
Okay. And when you came back to the ward, was your pain well controlled?
Yeah, I had no problems. If I did, I just spoke with the nurse.
Yeah. And they give you extra pain relief if you needed it?
Usually overnight.
Yeah.
Yeah,
It would be a bit
that was it.
worse. Okay. And how did you find your therapy input on a whole when you were in hospital?
Great, yeah. Every day somebody come to see you and got you up and
Yeah. And what kind of things did you do?
small exercises on a daily basis, making sure I could get to the bathroom and things like that, yeah.
Lovely, so just getting you prepared for home really.
Yeah.
Okay. And how did you find your overall experience of having a knee replacement? Has it helped you?
Yeah, I was quite apprehensive at first. I, you know, really frightened, but now they put me at my ease and everything just went great.
Good. And was it worth it?
Oh, brilliant, yeah. I can actually do my job properly now because I was 12 months on crutches, so, yeah.
Okay, you're doing all your daily activities
Yeah.
as normal.
Yeah, everything.
Perfect. Good.